When coordinating care and outpatient services, which of the following is a crucial factor to consider? So when they're talking about the coordination of care here, or like the continuation of care and the outpatient services, this is likely referring to maybe if you have a patient in an acute care facility like a hospital, and then you're planning their discharge and who they're going to be following up with outside of the hospital and outpatient services, or just in general a patient looking for some sort of outpatient service, so any sort of facility where there's providers. It's not a hospital. What are some things that you want to consider about this patient and the situation? So option A says the patient's preferred time for appointments, and that might be helpful information, the preferred time, but that doesn't really relate to the coordination of care, because regardless of where they're going, that could be figured out between the patient and the facility when they're booking their appointments. That doesn't really apply to specifics of where they're going to go, so we can eliminate that. Option B says the proximity of the patient's residence to the service location. Maybe, because that might be important to note the distance that they'll be traveling based on where they're living. Option C says the patient's dietary preferences, and not really, because if we're looking at just providers and locations of where to go to coordinate care, that doesn't really have to do with the type of diet that they're on. So we can eliminate option C. And then option D says the availability of transportation for the patient. Now, you might find yourself a little stuck between these two choices, availability of transportation and the proximity of the patient's residence. Now, think of it this way to help you come to the conclusion of the correct answer. Let's say like the patient is here, right? And this is their home. And then let's say that the facility they have to go to is over here. And now it could be kind of relative to whoever's scheduling and thinking, oh, they're not too far. This is only, let's say, 3 miles from their house. And that can be all well and good, but if the patient doesn't have a way to actually get from point A to point B, it's kind of a moot point. So what's really more important is their availability to get transportation, because the office could be pretty close to their house, but if it's not walking distance and the patient can't drive, and then therefore they wouldn't really be able to get to their appointment, then that would really be a bigger consideration to have, which could really be relative to whoever's planning it. So for that reason, option D will be what we're going to, the availability of transportation, because we're really focusing on accessibility needs here.